Hi everybody, my name is Dr. Mike Blaney, bariatric surgeon in Augusta, Georgia. And today on our YouTube channel we're going to answer some common questions that our patients ask. Today's question has to do with why am I dumping and what types of foods may cause dumping. Now the term dumping is used rather generically across the bariatric industry. Dumping is really symptoms of hypoglycemia, in other words, low blood sugar. And typically this is a physiologic response, mostly after the gastric bypass because of the rapid emptying of the gastric bypass pouch into the small intestine that triggers a rapid rise in blood sugar, and most commonly this is due to eating foods that are high in simplified or non-complex carbohydrates or simple sugars. It may be contained in foods that are sweet, such as candy and dessert items. So what happens is that the emptying of the gastric bypass pouch with these types of foods will result in a rapid increase in our blood glucose level, which will be sensed by our pancreas that will trigger the release of insulin, and insulin is a hormone that will lower our blood sugar. So the physiologic response to this is a lowering in our blood glucose level as a result of the rising insulin levels that leads to symptoms of hypoglycemia. And hypoglycemia is commonly experienced by patients as symptoms of nausea, abdominal discomfort, diarrhea, generally feeling ill or washed out, and feeling weak and tired until that blood sugar level comes back up. So the avoidance of dumping is generally a dietary changes and avoidance of simple sugars. Now it gets a little more complicated with other foods, and commonly we will see a few patients that will have some dumping symptoms related to a variety of other foods, such as complex carbohydrates. These are foods that are high in carbs but generally require more time in order to digest, like breads or foods, whole grain fibers and things of that nature. We don't see that too often with the simple sugars, but then there are even patients who claim that they have dumping related to other foods such as proteins, meats, and vegetables. And to ascribe a physiologic response to this is a little bit difficult. I think a lot of times those symptoms that patients are experiencing, quote-unquote dumping symptoms that are not eating simple sugars, are probably overstretching their pouch from volume and are feeling ill as a result of that. And they're just generally saying that they're experiencing dumping because of the discomfort or uncomfortable feeling that they're having related to overeating or certain foods that just may not sit well. And I think most experienced bariatric patients would tell you that certain foods after surgery, they just don't tolerate that well anymore, and this may be transient or may be longer term. Now, as it relates to the other procedures, sleeves and duodenal switches, we typically don't see a lot of dumping symptoms with those patients because those individuals still have what's called the pyloric valve. And the pyloric valve is the control mechanism for emptying of the stomach. So remember, dumping has to do with the rapid emptying of the stomach. So with the gastric bypass, there is no longer the pyloric valve that's controlling the emptying of the gastric bypass pouch. With the sleeve and the bypass, with the sleeve and the duodenal switch, there is still the pyloric mechanism in place that still slows the emptying of the stomach and allows for those foods to empty into the small intestine in a more controlled manner, which would generally prevent the slower rise in blood glucose level, the slower rise in insulin, and the slower decrease in our glucose as insulin rises. So, this gets very technical and physiologic, but suffice it to say, for our patients with a gastric bypass, dumping is related mostly to eating foods and simple sugars, and our patients with the duodenal switch and the sleeve gastrectomy generally will not experience these symptoms. So I hope this answered your questions, and we look forward to helping you answer the common questions associated with bariatric surgery on our YouTube channel. If you found this helpful, please be sure to subscribe to our channel